Hello everyone. Today we'll discuss about the renal system or excretory system. The system which is meant for the excretion in the either in the solid way or in the liquid way or in the fluid way is called as excretory system. So as we know, the solid part of the excretion is in the digestive system after the completion of the digestion and the absorption. So by the anal canal and the rectum. Okay, and next one is this fluid part. So after the metabolic waste, okay, after the metabolism, after the completion of the metabolisms, and the blood carries the metabolic waste from the tissues to the some organs, and there the blood get filtered and the liquid waste purified and by the blood, and this blood carried out to the heart, and again it supplies to the tissues. Okay, right. This excretion system is mainly by the two types. One is by the kidney and another one is by the skin. Later on we'll discuss about the skin, and first come to the kidneys. What is this kidneys? Kidneys are the part so where this blood gets filtered and the liquid waste and the metabolic waste and whatever the substances are there, so those are excreted through the kidneys. That is called as urinary system or the renal system. Renal system is nothing but the by the kidneys. Excretion by the kidneys is called as the renal system. Okay, right. In this renal system, so the kidneys, first of all, the kidneys, so they are so filter the blood and the liquid waste collected into the nephrons, and through the ureters it sends to the urinary bladder, and through the urethra it sends out. That is what the excretion. And today we'll discuss about all this process, how it is, and how the acidification of the urine, how the concentration gets changed in the urine, and how the urine is formed, and what are the organs present in the renal system and the excretion system. All this we'll discuss today. And first come to the kidney. Yes, right. Kidneys. What are the functions of the kidneys first of all? Okay, if you see the functions of the kidneys, the first one is the role in homeostasis. It maintains, kidneys maintains homeostasis. What is homeostasis? Homeostasis is nothing but maintenance of internal environment, milli-intra. Okay, right. And next one is hemopoietic function. So these are kidneys are undergo for the RBC production. Okay, and next one is endocrine function. So these are secretes some hormones like renin. So these are and also in the part of the endocrine system also. And next one is regulation of the blood pressure. By the filtration of the blood process, it regulates the blood pressure. And next one is regulation of the blood calcium level. This is the most important. So the calcium level is maintained by the kidneys. If the calcium level is increased in the body, then the calcium excretion is more, and the calcium level are decreased in the body, that in the sense blood, then the excretion of the calcium is decreased. Like that, it maintains the calcium level. And next, if you see the functional anatomy of the kidney, so here this kidney is in three layers actually. One is cortex, that is called as the renal cortex also, and another one is renal medulla, and next one is renal sinus. Okay, renal cortex, renal medulla, and the renal sinus. Right. First come to the structures are present in this. One is nephrons and another one is tubules, which collected the waste from the nephrons. Those are called as tubules or the collecting tubules. Like this, we have two structures. So one is nephrons and another one is collecting tubules. Okay, right. And next one is, if you see this diagram, the outer layer of the kidney is called as cortex, and just below the cortex is called as medulla, and the innermost part where the opening of the kidney is called as renal hilum. Okay, opening of the kidney called as renal hilum, and this renal hilum and the medulla, in between this there is a part, that part is called as renal sinus. Okay, cortex outer part, and next medulla, and next renal sinus, and after that opening of the kidney, that is called as the renal hilum. Okay, right. And here this kidney is in the shape of vein, and a pair of the kidneys are present in the lumbar part, that is in between L2 to L5. Okay, right. And next a pair of kidney are present. Okay, and after this the nephrons. If you see these nephrons, nephrons are the structural and functional unit of the renal system, because these are the major organelles which takes the major role. That in the sense, urine is formed in the nephrons, and the acidification of the urine is in the nephrons, and the blood pressure maintained in the nephrons, and the homeostasis maintains in the nephron. Each and every function is maintained in the nephrons itself. That's why these are called as structural and the functional unit of the renal system. Okay, right. In the kidney there are capsules, pyramidal capsules are present. 5 to 7 capsules are present in each kidney. In each pyramidal capsule, millions of the nephrons are present. Okay, in each pyramidal capsule, millions of the nephrons are present. All these nephrons forms the urine by the filtration process of the blood, and that is collected into the collecting tubules, and those collecting tubules comes out of the pyramidal capsules and through the renal sinus. So it joins and it all attached together and it forms ureter, and that comes out of the kidney and there. So that poured into the urinary bladder. This is what the process in the this nephrons and kidneys, and next after that urinary bladder. And through the urinary bladder, so the urine is excreted by the pressure gradients, different types of the pressure gradients, and through that, so the urethra passes out. Okay, right, come to the point. And next one, if you see the parts of the nephron, the first part of the nephron is called as the glomerulus. The U-shaped part is called as glomerulus. In this, so we have one is efferent arteriole, which is coming inside of the nephron, and another one is which is going out of the nephron is called as efferent arteriole. In between these two, efferent arteriole and the efferent arteriole, there is glomerular capillaries, and upon this there is a U-shaped structure is present, that is called as glomerulus. And after the filtration through the small pores, and that urine is collected into the glomerulus, and that is enters into the proximal convoluted tubule. Second part of the nephron, it is proximal convoluted tubule. First part is glomerulus, and next one is proximal convoluted tubule. And next, proximal convoluted tubule is converted as the descending thick segment of the tubule. Descending thick segment of the tubule descends it is, and there is a thick layer present, and it is a tubular part. That's why it is called as descending thick layer, or the descending thick segment of the tubule. And after that there is thin layer. In the descending only there is thin layer, that is called as descending thin segment of the tubule. And after that there is a U-shaped structure again in the below part, so that is called as loop of Henle or Henle's loop. It is like hairpin bend structure, that's why it is called as loop of Henle or Henle's loop it is. Okay, so and next after that, till that there is a descending part, and next it ascends. Okay, so that ascending part, in the sense the urine ascends there. Okay, that's why it is called as ascending segment of the tubular part, and that is in thin layer it is. So that it is called as ascending thin layer, or the ascending thin segment of the tubular portion, and it continues as the ascending thick segment of the tubule, and after that distal part or the distal tubule or the distal convoluted tubule, and next it connected to the collecting tubule. Okay, so this is what the structure of the nephron. And after the structure of these nephrons, and next one is types of nephron. So if you see this diagram, we'll get the two types of the nephrons. One is, so we'll get somewhat clear this, okay, right, and see this, okay, there are two types of the nephrons are present. One is medullary nephrons or the juxtamedullary nephrons, and another one is cortical nephrons. Okay. Medullary nephrons or the juxtamedullary nephrons, in the sense the nephrons portion of the glomerulus. The glomerulus which is present in the medulla or nearby medulla is called as medullary or juxtamedullary nephrons, and if the glomerulus part of the nephron is present in the cortex is called as cortical nephrons. Like that, there are two types of the nephrons. One is cortical nephrons, the nephrons glomerulus which is present in the cortex, cortical nephrons, and the glomerulus part of the nephron, so is present in the medulla or nearby medulla, is called as medullary nephrons or the glomerular juxtamedullary nephrons. Okay, right, and after this, if you see the renal corpuscle, so that in the sense, then glomerulus and the efferent arteriole which is coming inside of the glomerulus, and the glomerular capillaries, and next efferent arteriole. Including of all these parts, it is called as renal corpuscle. See once again, so renal corpuscle in the sense, so this is also called as Bowman's capsule. Okay, so the glomerulus part, so which is in the U shape, nephrons part, it is starting nephrons part, and the efferent arteriole, the blood vessel it is which is entering into the glomerular portion, and next glomerular capillaries, so which are inside of the glomerulus, and next efferent arteriole which are going away from the nephron. So including of all these parts, that is called as renal corpuscle. Okay, right. And next one is juxtaglomerular apparatus. This juxtaglomerular apparatus, in the sense, a part, so which is nearby the glomerulus, juxta in the sense near, and it is nearby glomerulus, that's why it is juxtaglomerulus, that is a apparatus. That's why it is called as juxtaglomerular apparatus or the JGA, and it contains three types of the cells. In this we have three types of the cells. One is macula densa, and another one is extraglomerular mesangial cells, and next one is juxtaglomerular mesangial cells. Macula densa, extraglomerular cells, and juxtaglomerular cells. Three types of the cells are present here. And if you see this structure, so we'll come to know very clearly. Okay, so efferent arteriole, in between the efferent arteriole and the efferent arteriole, green colored portion, that is called as a cells. These are the largest cell in the out of these three types of the cells. Those are called as macula densa. And next, another one is the proximal part, near the proximal part. So there is another type of the cells are present. Those are called as juxtaglomerular cells. These are the fixed cells. Whereas come to the macula densa, it is flexible, movable it is. Whereas come to the juxtaglomerular cells, so just below the efferent arteriole, and in between this efferent and the efferent arteriole, here the macula densa is present, and the juxtaglomerular cells are present here. Okay, so just below the efferent arteriole, which is coming inside of the glomerulus, that is for the efferent arteriole. Below this, there is presence of the this juxtaglomerular cells, and next macula densa. So in between the efferent and the efferent arteriole, here it is. Okay, and next, just beside of this macula densa, there is presence of the extraglomerular mesangial cells. Like that, three types of the cells are we have in the juxtaglomerular cells. And what is the function of this? In the sense, it secretes hormones, and it maintains the blood pressure. Okay, so regulation of the blood pressure and the secretion of the hormones. It secretes two types of the hormones. One is renin and another one is prostaglandins. And next one is it maintains blood pressure. How it maintains blood pressure? In the sense, so the juxtaglomerular cells, so these are the fixed cells, and when the pressure is increased in the efferent arteriole, the macula densa, so which is present in between the efferent arteriole and the efferent arteriole, that comes near to the, so this efferent arteriole, above the efferent arteriole, and it applies the pressure on this. Below this we have juxtaglomerular cells, isn't it? And here this cell macula densa comes upon that and it applies the pressure on this, and the pressure in the glomerulus is decreased. Like that, it regulates the blood pressure. And next, after this, so this is what the regulation of the blood pressure, and another type is regulation of the blood pressure by the secretion of the renin. So how it is, in the sense, there is a system, that is what RAS, renin angiotensin aldosterone system. So we'll come to know this very clearly in the CVS, cardiovascular system. So but just remember that the renin is secreted in the kidneys, especially by the juxtaglomerular apparatus. Okay, right. So it is a system maintained by the, so this, so that in the sense what, first of all the renin is secreted, and then this RAS system, renin angiotensin aldosterone system, is activated, and by that there is a regulation of the blood pressure. Okay, right. And next one is the renal circulation. What is this renal circulation? The renal circulation in the sense how the blood coming inside of the kidneys and how it going out, and so what is the process, what are the blood vessels are present, and what are the venous system is present, and what is the arterial system is present in this. That is what the renal circulation. So if you see the renal blood vessels, okay, so here you will get very clearly, so the first vessel is the artery, that is renal artery. It is comes from the hepatic artery. So there are totally 5 vessels are there, like renal artery, segmental artery, and next interlobular artery, and next renal arcuate artery, and interlobar artery. If you see the sequential diagram of the renal circulation, that is as like this. So if you see this, the first one is abdominal aorta, which is coming directly from the heart. Okay, so this from the abdominal aorta, there is a portion coming outside near the kidney, that is called as renal artery, which is supplied to the kidneys, is called as renal artery. This renal artery enters into the hilum of the kidney, hilum of the kidney, and then so it divides into segments. So like in the sense there are pyramidal capsules are present. So it should supply this renal supply. Renal artery can't supply to the all pyramidal capsules, isn't it? Okay, that's why it divides into, so depends upon the capsules, and it supplies directly to the capsules. That is called as segmental artery. Okay, so renal artery, and next one is segmental artery. And this segmental artery goes near to the, so capsule, pyramidal capsule, and after this pyramidal capsule, immediately, so when this segmental artery goes to the pyramidal capsule, and then it forms it enters into the capsule, and then that is called as interlobar artery. That is called as interlobar artery, and after that, that capsule is like this, isn't it? Okay, so capsule is like this. So when this enters into the capsule, that is called as interlobar artery, and this interlobar artery so moves, so off of the part of the pyramidal capsule one side, and another side one side, so that 2 sides, so it makes like this, like it forms a arch. That's why it is called as arcuate artery within the capsulators. Okay, and next, so it enters in between the middle portion of the pyramidal capsule that is called as interlobular artery. Interlobular artery. Abdominal aorta, renal artery, segmental artery, interlobar artery, arcuate artery, interlobular artery. Okay, right. And this interlobular arteries so goes a bunch of the nephrons, and there it divides into the efferent arterioles, so which are directly supplies to the glomerulus part of the nephrons, efferent arterioles. And next glomerular capillaries, and which is going out of the glomerulus is called as efferent arteriole. And all the efferent arterioles come together and it forms vasa recta and the peritubular capillaries. By the peritubular capillaries, and next this peritubular capillary in the sense all are on the tubules. On the tubule, that's why it is peritubular. The capillary is present on the tubules, so that it is called as peritubular capillaries. And next, all the peritubular capillaries come together and it forms vasa recta. Okay, and this vasa recta goes same to the near to the interlobular artery, so that is called as interlobular vein. It is. Okay, interlobular vein, and so it goes on the pyramidal capsule upper part, that is called as arcuate vein. It is. And next, arcuate vein comes out of the pyramidal capsule, that is called as interlobar vein. And all the interlobar veins of the pyramidal capsules come together and it forms segmental vein. And these segmental veins come together and it forms renal vein, which is coming out of the kidneys through the hilum. Okay, so that is what the renal circulation process. See once again, abdominal aorta, and next renal artery, next segmental artery, next interlobar artery, next arcuate artery, next interlobular artery, next efferent arteriole, next glomerular capillaries, next efferent arterioles, next vasa recta by the formation of the peritubular capillaries, next interlobular vein, next arcuate vein, next interlobar vein, next segmental vein, next renal vein, and through the IVC it goes directly to the heart. This is what the renal circulation. And next one is, see this diagram once again, so you'll come to know what is uterus. You will get very clear picture here. So what is the efferent arterioles, what is peritubular capillaries? Peritubular capillaries all are present on the tubular portion, that in the sense there is no collecting duct involved and no glomerulus is involved. At the part of glomerulus we have only efferent and glomerular capillaries, isn't it? Okay, and next, peritubular capillaries all are on the, this one, tubular portion, and it forms vasa recta. And different kinds of the arteries, veins will come to know. Okay, and next one is urine formation. How this urine is formed? In the sense, urine formed in the three ways. By the filtration process, it formed in the three ways. The first one is glomerular filtration, and next one is tubular reabsorption, and next one is tubular secretion. Sense? So there are three steps involved in the formation of the urine. First one is glomerular filtration, next tubular reabsorption, and next one is tubular secretion. Like this, we have three steps involved in the formation of the urine after the filtration process of the blood. Okay, right, and this urine formation is in three steps. Okay, so in that, the first one is glomerular filtration. This glomerular filtration is nothing but the process at the part of the glomerulus of nephron, the first part of the nephron. Okay, and the efferent arteriole which is coming inside of the glomerulus, and next glomerular capillaries and the efferent arterioles are involved in this process. What happens here in the sense, the blood coming into the efferent arteriole through the renal circulation and the glomerular capillaries. So here, this part is somewhat large capillary is present. The plasma proteins are not filtered in the glomerulus. Okay, plasma proteins are directly goes the upper portion of the glomerular capillaries, and remaining blood part is filtered in the glomerular capillaries of the remain capillaries, and next after this process through the efferent arteriole it goes out of the glomerulus. Okay, right. In this what happened, there is the pressure, glomerular pressure is present about 10 millimeters of mercury. Okay, so by this pressure gradient, glomerular pressure it is. Okay, so by this pressure gradient what happens, so the blood is filtered, that in the sense the liquid waste comes out of the capillaries through the pores, and that is collected into this part of the glomerulus, and the pores present on the glomerulus, so that collected inside of the glomerulus. Okay, right. This filtration process, so through this, how much amount of the blood is filtered is called as glomerular filtration rate. It is. Okay, the amount of the blood filtered in the glomerulus is called as glomerular filtration rate. It is about 125 ml per minute and 80 liters per day. Okay, and next, after this process, so completion of this glomerular filtration process, so there is a filtration fraction. Filtration fraction in the sense, so the fraction, so after the filtration is called as the filtration fraction. Okay, so here the pressures, there are, one is intraglomerular pressure and intra-arterial pressure and intra-capillary pressure. These three are very important here, pressure gradients. Okay, and after this, so what happens, the glomerulus is mainly depends upon the net filtration process. This net filtrate pressure is equal to the glomerular capillary pressure minus colloidal osmotic pressure plus hydrostatic pressure difference. The glomerular capillary pressure minus colloidal osmotic pressure and the hydrostatic pressure difference. So including of the colloidal osmotic pressure and the hydrostatic pressure difference and the glomerular capillary pressure. So the difference between these two is called as net filtration pressure. Like that is, the glomerular capillary pressure is about 60 millimeters of mercury and the colloidal osmotic pressure is about 20 millimeters of mercury, and next the hydrostatic pressure is about 15 millimeters of mercury, and totally will get 20 millimeters of mercury. That is the pressure present in the glomerulus. Okay, that is for the net filtration pressure it is. And so how with this process, in the sense, when there is increase in the glomerular filtration rate, immediately increase in the sodium chloride concentration in the renal tubules. Okay, and next then the macula densa. So what happens, then there is adenosines and the constriction of the efferent arteriole by the macula densa and the juxtaglomerular cells process, and decrease in the glomerular filtration flow, and finally the tubuloglomerular feedback mechanism. It is called as tubuloglomerular feedback mechanism. When the pressure is increased, at that time this process works. This is called as tubuloglomerular feedback mechanism. When there is increase in the GFR, for the decreasing in the GFR, this process is worked out. That is called as tubuloglomerular feedback mechanism. Okay, and next one is the factors which regulates this or the affecting glomerular filtration rate. In the sense, first one is renal blood flow. How much amount of the blood is coming inside? That is one. And next one is tubuloglomerular feedback mechanism, what we saw just now. Okay, and next glomerular capillary pressure, that is also very important. And next one is colloidal osmotic pressure. If it is increased, the filtration fraction may differ. And next hydrostatic pressure, that is also same as like that. And next concentration of the, so this constriction of the efferent arterioles for the blood pressure maintenance. And next one is the constriction of the efferent arteriole. Constriction of the efferent arteriole, so that leads to the GFR is decreased. If the constriction of the efferent arteriole, which is coming out of the glomerulus, then the GFR is increased because the pressure is increased when the constriction of the efferent arteriole. Okay, and next one is systemic arterial pressure. This is also very important. So not only in the renal, if it is affects the total systemic arterial blood pressure, it affects on the renal tubules and the renal glomerulus and the each and every arteries also. Okay, and next one is the surface area of the capillary membrane and permeability of the capillary membranes, and next concentration of the glomerular mesangial cells and hormonals and the other factors. And the factors which decreases the GFR by the vasoconstriction process. In the sense, the angiotensin 2, so which is activated by the renin, so which is secreted by the juxtaglomerular apparatus. Renin is secreted by the juxtaglomerular apparatus of the kidneys, and this angiotensin 2 is activated by the renin. Okay, and next one is endothelins, and next noradrenaline, and after that platelet activating factor, and next platelet derivating growth factors, and next prostaglandin, that is PGF2. Okay, and next, so which increases glomerular filtration rate. So the factors which increases the glomerular filtration rate. So in this, the atrial natriuretic peptide, which is secreted by the heart. It is a hormone secreted by the heart. Okay, and next one is brain natriuretic peptide, so which is secreted by the brain. It is a hormone secreted by the brain. And next one is CAMP, cyclic AMP it is. And next dopamine inhibitor it is. And next endothelial derivative nitric acid, and next prostaglandins like PGE2. PGF2 decreases and the PGE2 increases. And next, another process, that is tubular reabsorption. In this tubular reabsorption, some of the substances are reabsorbed from the tubular portion, like glucose, creatinine, and urea, uric acid are reabsorbed into the tubules. Okay, so is called as tubular reabsorption. And next, so here this selective reabsorption it is. And next mechanism of the reabsorption is like, so the substances which are present in the interstitial fluid, those are reabsorbed into the tubular portion. Okay, and next the site of the reabsorption is in the tubular portion, that in the sense descending segment and the ascending segments. Okay, so majorly it is in the only descending segments. Okay, and after that, this regulation of the tubular reabsorption by the pressure gradients and the interstitial fluid are present in between the this descending and ascending segments. And after that, so the loop of Henle and the concentration of the urine, all these are involved in this process. And next, threshold substances. So the permeability of the capillary membranes and the concentration of the substances is also very important. That is what the threshold substances. And next, so transport maximum. So how much amount of the urine formed by the glomerulus is transported by the through the tubule is called as transport maximum, or the Tmax it is. Okay, and next one is reabsorption of the important substances. So that is what glucose, urea, creatine and uric acid. Okay, and next one is tubular secretion, and this tubular secretion is nothing but secreted into tubule. Okay, so the substances which are taken from the tubular portion is called as tubular reabsorption, and tubular secretion in the sense secreted into the tubule. Okay, right. So the substances secreted in the sense, so what are the excessive substances present in the blood after the efferent arterial process, that in the sense glomerular filtration process. Okay, so there are peritubular capillaries are present on the tubular portion. In the ascending segment and the distal convoluted tubule, what happens? The excessive amount which is present in the blood, those substances are secreted into the tubular portion is called as the tubular secretion. And here majorly water, sodium chloride and urea, uric acid, these are the substances so secreted into the urine or the tubular portion, like this ascending segment and the distal convoluted tubule. Okay, right. And next one is, if you see this in the tubular reabsorption part, so the glucose, amino acids, proteins, vitamins, lactate, urea, uric acid are reabsorbed from the tubular portion. And so after that descending segment, so the urea, uric acid, creatine and some of the drugs are reabsorbed. Okay, and next one is water is reabsorbed from this thin segment of the descending portion. Okay, and next one is, in the loop of Henle, the urea is reabsorbed, and next, in case of the ascending segment, sodium, potassium and chloride ions are reabsorbed from the ascending segment. And whereas come to the secretion into the tubule segment is water, hydrogen molecules and the potassium molecules and the ammonium molecules. Okay, so that is what this process. Okay, so complete glomerular filtration and the tubular reabsorption, tubular secretion. Glomerular filtration in the sense filtration of the blood and the waste substances are collected into the glomerulus and enters into the tubular portion, and tubular reabsorption in the sense reabsorbed from the tubule, and next one is tubular secretion in the sense secreted into the tubule. Excessive substances which are present in the blood, secreted into the tubular portion is called as tubular secretion. Okay, concentration mainly depends upon what are the substances coming inside of the tubule, what are the substances going out of the tubule, and this concentration majorly depends upon the countercurrent mechanism, and another one is the role of ADH. ADH in the sense antidiuretic hormone it is. Okay, so this countercurrent mechanism is again divided into two types. One is countercurrent exchanger and another one is countercurrent multiplier. Okay, so the countercurrent exchanger in the sense exchanged from the distal part to, that in the sense descending part to ascending part, so exchanging of the substances. Okay, so that is what the countercurrent exchanger. Countercurrent multiplier in the sense the concentration goes on increases while descending, and the ascending, while the ascending, that is decreases. The concentration is decreases while the urine is ascends, and the concentration is increased while the urine is descends in the distal descending tubule and in the ascending tubule. Okay, so what is countercurrent exchanger? In this, we should remember two parts. Okay, one is removal of the water and the adding of the sodium chloride. removal of the water and the adding of the sodium chloride is nothing but the concentration is increased, and removal of the sodium chloride and adding of the water is nothing but the concentration is decreased. This is what the process in the counter current multiplier. Okay, right. And next one is the counter current exchanger. The counter current exchanger is nothing but the process which is involved. So by the exchanging of the substances from the ascending to descending part and descending to ascending part. If the substance coming from the ascending part, there the concentration is decreased, and that substance is coming into the descending part and there the concentration is increased. That is what the sodium chloride. Okay, removal of the water, the sodium chloride came from the ascending part to descending part. Immediately there the water molecule from the descending part exchanged from the descending part to ascending part. There is another chance of the concentration decrease in the ascending part and the removal of the water from the descending portion, so that obviously there is the concentration is increased. The first concentration in the glomerulus is about 300 milliosmoles, and when it reached to the loop of Henle, that is 1200, and when it reached to the distal convoluted tubule, that is about the 150 milliosmoles, and when it reached to the collecting tubule, again collecting tubule and the collecting duct, then it is again 1200 milliosmoles. This is the final concentration of the urine. Okay, the final concentration of the urine is about 1200 milliosmoles. The concentration gradients changed during the exchanging of the substances and the removal of the substances and the adding of the substances. Next one is renal function test. So what is this renal function test? In the sense, the properties of the urine, the examination of the urine, all are comes under this renal function test. Okay, first come to the properties of urine. The volume is about 1000 to 1500 ml per day. Okay, and next one is reaction is slightly acidic with the pH of the 4.5 to 6. And next one is specific gravity is about 1.010 to 1.025. And next osmolarity is about 1200 milliosmoles per liter. Okay, and next one is color is normally it is straw in color. Straw colored fluid it has. And next one is odor, the fresh urine, light aromatic smell, and after the if it is stored by the bacterial and the fungal growth, and it becomes stronger and by the bacterial and decomposition of the urine. Okay, and next one is if you see the composition of this urine. So the composition of the urine is the substances water and the solids. The water is about 92% and the substances, solid substances are about 8%. And here the solids are again divided into organic and inorganic substances. Okay, right. If you see the inorganic substances like sodium, potassium, calcium, chloride ions, and the phosphates and the sulfate ions. Inorganic substances. And next one is organic substances are like urea, uric acid, creatinine and the ammonia are present. Organic substances. And next one is physical examination. If you see the physical examination of the urine, so while sample collected, so then in the first physical examination according to the properties, the first one is volume, how much amount of the volume is collected. And next one is color, appearance, specific gravity, osmolarity and the pH and the reaction. And next microscopic examination. So if there is, so after the collecting of this urine, generally preferable is midstream urine, that in the sense after excreting of the some amount of the urine, in the middle of the passage urine, that that sample should be taken, that is called as midstream urine. Okay, so in that, so that is centrifuged and the supernet part is left, and the whatever the substance is remain, so that is collected, and drop of that amount is taken on the slide and so observe under the microscope there. If there is presence of the RBC cells, generally 4 to 5 cells are present, and next one is WBC cells or anything is present, and next epithelial cells are present or not, and next cast cells are present or not, crystals are present or not, and bacteria present or not. Next, chemical examination, examination of the blood like serum urea, uric acid and creatinine, and next examination of urine like what are the substances are present in the urine like ketone bodies, albumins, proteins, all this, and next examination of the blood and urine in the sense. So what are the substances present in this? So that is what the blood and urine examination. Okay, and next one is renal failure. So what happens if the renal failure occurs? What is renal failure actually? In the sense, when the kidney loses its function is called as renal failure. That in the sense there is no filtration at all. Okay, so that is in two types. One is acute condition and another one is chronic condition. In case of the acute failure, that is because of the acute nephritis, and next one is damage of renal tissue by poisons, and next one is renal ischemia. And acute tubular necrosis and severe transfusion reactions. Next, sudden fall in the blood pressure during the hemorrhages, diarrhea, severe burns and the color. Next one is the blockage of the ureter due to the formation of the calculi or the tumors. And next, if you see the features of this, oliguria in the sense decreased urinary output is called as oliguria. And next one is anuria in the sense cessation of the urine formation is called as anuria. And next one is proteinuria. Proteins are present in the urine is called as like albumins, globulins are present in the urine, that is called as proteinuria. Okay, and next one is edema. Edema in the any part of the limbs. And next hypertension is also one of the cause. And next acidosis, coma due to the severe acidosis. And another one is chronic disease, and that in the sense chronic renal failure. This chronic renal failure is mainly depends upon the, if you see the causes of this, so that is one, first one is chronic nephritis. Nephrons are failed in function, that is called as chronic nephritis. And next one is polycystic kidney diseases and renal calculi and urethral constrictions, hypertension, and next atherosclerosis, and next tubulosis, and next one is slow poisoning by the drugs and the metals. And if you see the features, that is uremia, acidosis, edema, blood loss, and anemia, hyperparathyroidism, and next osteomalacia. Micturition is nothing but voiding of the urine is called as micturition. This micturiation is recorded on this graph, that is called as cystometrogram. Okay, cystometrogram in the sense the contractions of the urinary bladder is recorded by a apparatus, that is cystometrogram. Okay, so this system, if you see this, there are three types of the contraction occurs in the urinary bladder. First, 0 to 400 ml of the filling of the urinary bladder, there is no contractions are there, and 400 to 500 ml there is slight contraction, that is type 2 contractions are type 1 contractions are present, and 500 to 600 ml severe contractions, that is type 2 contractions are present. And if it is beyond the 600 ml, the urine is passed drop by drop. Generally, the urinary bladder capacity is about 100 ml, but it can store only 700 ml of the urine. But the contraction, severe contraction starts after the filling of the 600 ml only. So when it fills 500 to 600 ml, then the person cannot concentrate on anything. Okay, so this is psychological feels. Okay, and next same time the urinary bladder fillings we can see. So by this graph, type 1, type 2 and type 3 contractions. Okay, and next one is see how it fills and how the micturition reflex is there. In the sense, when there is filling of the urinary bladder, immediately there is stimulation of the stretch receptors in the urinary bladder, and after that, so there is afferent impulses through the pelvic nerve. Afferent impulses through the pelvic nerve, and the sacral segment of the spinal cord receives that signals. That afferent signals from the pelvic nerve received by the sacral segment, and then efferent impulses via the pelvic nerve. Again, efferent impulses sends through the pelvic nerve, and then there is contraction of the detrusor muscle and the relaxation of the internal sphincter of the urinary bladder. And after this, then flow of the urine through the urethra and the stimulation of the stretch receptors again. There is external sphincter is there, so that there is stimulation of the external sphincter. Okay, and next through that stretch receptors. Okay, so the efferent impulses via the pelvic nerve, and immediately the inhibition of the pudendal nerve. The one and only nerve which is activated so all over the 24 hours per day is the pudendal nerve. When it is inhibited, then there is the passage of the urine, and when it is activated, then there is no passage. Okay, like that there is inhibition of the pudendal nerve, and then relaxation of the external sphincters and the micturition process, like voiding of the urine. This is what the micturition process. And dialysis. If the renal failure is occurs, what happens? Then by the artificial kidney, okay, so that is a apparatus, artificial kidney it is. Okay, so by this, okay, the mechanism and the functions of this artificial kidneys, if you see this, the cut that is called as, there are two types of the dialysis are present. One is peritoneal dialysis and another one is hemodialysis. Okay, peritoneal dialysis and the hemodialysis. Okay, if you see this peritoneal dialysis, in the sense the peritoneal layer near the umbilical cord, so the peritoneal layer they inserted, so in and outputs, okay, through that the peritoneal dialyzing fluid is introduced into the peritoneal layer, and the waste substances are collected into the peritoneal fluid, that in the sense peritoneal dialyzing fluid, and what are the substances, minerals are required to the body, those are permitted into the body, and next that is collected out. The whatever the peritoneal dialyzing fluid introduced into the peritoneal layer, that is collected out, that is what the peritoneal dialysis. And in case of the hemodialysis, there is a process that is by the artificial kidney. So here, in the bronchial vein, okay, they cut these ends, and they'll go for the blood comes out of the one vein, and another end of the vein is connected to the another second part, output part of the artificial kidney, and there is hemodialyzing fluid is present. Okay, so in between that there is the process. See this is what the artificial kidney. So here, through this dialysis process, hemodialysis process, so there is a dilution of the membrane which is present in between the dialyzing fluid and the blood. Okay, so that collects, the fluid collects what are the waste material present in the blood, and next one is what are the substances it requires, it permitted into the blood, and then there is an output of the artificial kidney. Through that, the blood is again introduced into the body. So this hemodialysis process maximum in case of the chronic renal failure conditions. Okay, so this is what this, and next one is diuretics. Diuretics is nothing but So it influences the urine output. Okay, here this diuretics or general usage of the diuretics in the sense maximum it can be used by the athletes, so by the doping tests, so maximum we'll see. So all those are steroids, diuretics only. Okay, so but that is not correct process it is. Okay, so it maintains blood pressure actually. That's why only they'll take. Okay, and if you see this diuretics types, there are osmotic diuretics, and next one is diuretics which inhibits the active reabsorption of the electrolytes. And another type of the diuretics is the diuretics which inhibits the action of the aldosterone. And next one is diuretics which inhibits the activity of the carbonic anhydrase. And next, diuretics, so which increases the glomerular filtration rate. And another type is diuretics which inhibits the secretion of the antidiuretic hormone. And next one is the diuretics which inhibits the ADH receptors. These are the types of diuretics, and if you see this diagram, we'll come to know how this process. Okay, right. That's about the renal system as per my knowledge. Thank you very much.